the silent link between your mouth and your body. In 2016, researchers published an amazing study in the Journal of Oral Biology and Craniofacial Research that revealed something so eye-opening. Chronic inflammation in the mouth, particularly from gum disease, is a direct association with heart disease, diabetes, and even cognitive decline. But for decades, mainstream dental care has treated the mouth as if it were isolated from the rest of the body, and biological dentistry challenges that divide. It sees the mouth not as a separate entity, but as a vital part of the whole body system. And in doing so, it asks a powerful question. What if healing the mouth could help heal the body? What is biological dentistry? Biological dentistry, sometimes called holistic or integrative dentistry, takes a whole body approach to oral care. It combines modern dental techniques with an understanding of how dental treatments affect the body's internal systems. Your nervous system, your immune system, digestive system, and even emotional system. And at first glance, it may even look like traditional dentistry. You see, there are cleanings, there are fillings, and even diagnostics, but the underlying philosophy is different. Where conventional dentistry might just focus on repairing the damage, biological dentistry seeks to understand why the damage occurred and how to restore the balance beyond the tooth. It's a shift from fixing symptoms to fostering systemic health. The hidden risks of traditional materials. One of the most noticeable differences is the materials used. Biological dentists, yes, they avoid fluoride wherever they can, not because they dismiss science, but because they're aware of its systemic absorption and potential impact on the thyroid and pineal gland, particularly in people with sensitivities or compromised health. They also avoid amalgam fillings, which contain mercury, a known neurotoxin, because even trace amounts can affect brain and kidney, especially when fillings are disturbed or removed improperly. And in biological dentistry, safety is measured not only by durability, but by biocompatibility, how well a material harmonizes with your body's chemistry. And this brings us to something overlooked in mainstream practices, and that's testing, the role of biocompatibility testing. You see, no two people are the same. We know that. And biological dentistry honors that. And before introducing any restorative material, whether it's a composite resin, a crown, a bonding agent, many biological dentists perform biocompatibility testing. And this ensures that what goes into your mouth does not provoke an immune response or contribute to systemic inflammation. And for patients with autoimmune conditions, chemical sensitivities, or chronic illnesses, this personalized step is often not just helpful, it's essential. Reconsidering the root canal. Root canals have long been considered a routine solution for infected or dying teeth, but biological dentists look deeper. The concern is not just whether the tooth can be saved, it's whether that dead or treated tissue might harbor bacteria even after the procedure. Recent studies using scanning electron microscopes have shown that conventional root canals can leave behind microscopic tubules filled with residual pathogens. These may not cause immediate pain, but they can lead to long-term immune stress. And biological dentists, well, they weigh the risks. They may suggest alternative approaches such as ozone therapy to sterilize the area more thoroughly, or maybe even recommend extraction in certain cases, paired with safe techniques to support full body recovery. Toxins, teeth, and chronic illness. The mouth is an entry point, but it's also a potential reservoir. Old metal fillings, hidden infections beneath our crowns, or untreated gum disease can all act as silent disruptors, especially in individuals with chronic fatigue, fibromyalgia, or unexplained inflammation. Biological dentistry considers these dental toxins as possible contributors to disease, not in isolation, but as part of a broader health picture. And if you've ever cleaned up your diet, reduced stress, or started exercising but still felt stuck in your healing, the missing link could be dental. Supporting the body's natural healing, rather than suppressing symptoms with pharmaceuticals, biological dentists often support the body's own healing response. They may use therapies like low-level laser therapy, ozone, or homeopathics to stimulate regeneration. Nutritional guidance is common. So is collaboration with naturopaths, functional medicine practitioners, and integrative physicians. You see, the body is capable of healing when given the right conditions. And biological dentistry is about removing the blocks, physically, chemically, and energetically, that prevent that process. What to expect at your first visit? A first appointment with a biological dentist might feel more like a wellness consultation than a typical checkup. Yes, they'll assess your teeth and gums and your jaw and your whole dental system, but they'll also take time to understand your health history, immune status, diet, stress levels, and even environmental exposures. You might be asked about metal sensitivities, chronic symptoms, or prior dental work. Thermographic imaging or salivary pH testing may be part of the assessment. And instead of rushing towards treatment, there's a focus on listening and aligning with your body's needs. It's not just dental care, it's health care, rooted in the belief that your mouth tells the story of your whole being. The bigger picture, healing beyond the teeth. Biological dentistry does not reject science, it reframes science. It integrates emerging research with time, tested wisdom. It recognizes that a mercury-free filling, a toxin-free root canal, or a carefully chosen crown is not just about comfort. It's about reducing inflammation, restoring balance, and awakening vitality. For those navigating chronic conditions, mystery illnesses, or simply seeking deeper alignment between their health choices and personal values, biological dentistry offers something different. It's not just safer, it's smarter. More personalized, more compassionate, and it begins not with a drill or a diagnosis, but with a question. What does your body truly need to heal? This has been an holistic reflection guided by me, dentist Marc, known to many as the Dental Shaman.